And I want to talk to you for about 15-20 minutes then or so about transforming the healthcare terrain from biomedical to citizenship discourses. And as you may have already kind of picked up, I think within the field of certainly thinking about people with dementia, we're still quite a long way behind. And we've still got lots more work to do, haven't we? I think Jim and many other people in the room who are trying to promote a citizenship discourse within this field would agree with me there. So that's where we're at. So I want to, in this talk, just talk about how ideas of citizenship are perhaps becoming more visible and vital within healthcare, and perhaps specifically within dementia care, and that's thinking about increasing people's power and upholding rights and so forth, and also thinking about how biomedical discourse is still pervade. And in thinking about this transformation, I'd like us to reflect on this one question, which I'd like to pose to you, and that is thinking about the power axes, and what power axes is it that we need to nurture and resource when we're thinking about this transformation? Is it the one between individuals and the state, individuals and the government, or is it the one between communities of people with disability? So have that sort of question in mind, and that's the one I'd like to pose to you. I'll just highlight where I'm currently living and working, which is in Southampton, and just some facts there about the university and the place I work. I won't dwell too much on that, but just to say we also have lots of cruise liners in Southampton as well. So so there's some similarities there between Southampton and Vancouver. I can't think of any others, but there's certainly one there. But what I thought I'd like to start with is a story, and I think it fits in very well with some of the things Tim was saying about early on, about the importance of self-determination and supported decision-making specifically. And this is a story, a real thing that happened in England last year about this lady who you can see a picture of, and her name's Manuela Sykes. And this is a picture of her when she was a young woman with a career ahead of her in politics. She's now aged 89, or she was back in February 2014. And at that point, she won the right to return to her flat on a 1-month trial basis after a court protection heard she was miserable in a care home. Manuela Sykes, like about a third of people with dementia, are in care homes, and if you like, you could describe that as being segregated into care homes and being segregated and perhaps misplaced, displaced from their families and communities. So Manuela Sykes was not happy with that situation she was in. And unusually, the judge ruled in this case that she could be named in media reports, and this photo was released last year by Westminster Council, which the case was against. In 2006, she was diagnosed with dementia and appeared to have responded to that in some forthright manner. This is what it says in the court records. And she approached everything as she approached everything else in life. She participated in a dementia project and campaigned for the rights of people with dementia, and in particular older women. And in 2006, she made a living will, as many people with dementia are increasingly doing so, to make it clear about what their wants and wishes and desires are as and when they're perhaps no longer able to make them themselves. And that's what Manuela Sykes did. And sometime later in 2011, she appointed an attorney to make it quite clear that she wanted to remain in her home property. As I said, she won the right to return home on a 1-month trial basis. And just to highlight as well another comment that was made during the case and when they made the decision, a psychologist categorised her intensity to return home as an apparent obsession with returning home, so kind of highlighting it as a kind of either a symptom perhaps of her dementia and memory loss, or idiosyncratic kind of nature, rather than actually thinking, well, you know, someone has a right to live at home if they so wish. So that's the case of Manuela Sykes, and I wanted to start with that because I think it highlights and illustrates very well the overall theme of this conference about claiming full citizenship, and I think in this case Manuela Sykes did so, and also I think it highlights very well the notion of self-determination. And when I learned about this story, I began to think, what if everybody who lived in a care home who was miserable claim their legal right in the same way as this woman did? We'd perhaps have a movement then. So just very briefly, an overview of this talk. I'm just going to talk very briefly about the dominance of the biomedical discourse, which is still certainly within the dementia studies field. And also highlighting what citizenship can bring, and maybe one or two examples if there's time. So, just to highlight that, as we all know, it's biology and medical aspects of living with disease and illness are all very still persist and extremely common. Certainly within my role, I teach and supervise nurses and allied health professionals, and their first modules that they're studying are about anatomy and physiology. They're not about perhaps encouraging people to self-determine what they want to do and so forth. So it's still, perhaps understandably so, a common discourse within the field, and certainly within the dementia discourse, sort of images and questions like this are very common, and increasingly thinking about brain health as well rather than mental health, and I think many of this work is important, but it can become quite a dominant way of thinking about people with dementia. And so there's still a very big emphasis on finding a cure. So for every £10 of healthcare and social care costs attributable to each disease, cancer received £1.08 in research funding, and stroke received 19 pence in research funding, and dementia received 8 pence in research funding. So it's, even though it affects so many people, it still receives relatively little money, certainly in terms of medical research funding, and even more so in terms of social research funding. Since the Prime Minister's challenge and the Global Challenge on Dementia that came out in 2012, that's beginning to change, and research spend is increasing. So the Alzheimer's Society, who their strapline leading the fight against dementia, which I think is quite interesting in itself, that the charity claimed to be leading the fight as opposed to perhaps other groups, but their vision is for a world without dementia, and still continue. Well, they provide regular funds to the Alzheimer's Brain Bank. So it's obviously an important part of the discourse still. So let's think about what citizenship might bring to thinking about healthcare and thinking about people with dementia in particular. And Jim has already highlighted and said some of those things, but just to add, I think it brings a sort of political dimension to think about the lives of people with a disability or illness, and discussions about citizenship are inevitably about power and resources. And this photo, this image here, is of an exhibition that I was running about 3 years ago now, which involved people with dementia and artists, and together we created these banners in order to sort of raise awareness and challenge some of the stereotypes about people with dementia in a collective, equitable way. So I think that's sort of one of the aspects it can bring. And also I think with citizenship, it's about sort of recognition that maybe living with dementia is no joke, and actually having memory problems and cognitive changes in later life is not necessarily a laughing matter. In fact, there are increasing numbers of cases of people who are taking their own life when they're first diagnosed with dementia, because the prospect of living with this condition and not being able to make decisions unsupported, or there is no support for them to make decisions, is too much to bear. And there's a very good paper by Sue Wilkinson about an American academic, Nancy, can't remember her surname, but she took her own life fairly recently, actually, on having a diagnosis of dementia. So I think the idea of citizenship kind of raises our recognition of the situation and experiences that people have. And Jim's already kindly quoted and explained what we mean by social citizenship, and this is a programme of work, if you like, that myself and Deb O'Connor and many others who are in this room and across the world, we're endeavouring to bring this kind of perspective and discourse to the field of dementia studies, which has been for quite a long time very much led and by medical discourse. I just wanted to share some examples with you of how citizenship is becoming more prevalent within healthcare. How many of you have heard of NHS Citizen? Couple of people, okay. It's a fairly new process, if you like. It's not an organisation, it's not a thing. It was set up by NHS England about 18 months, 2 years ago, in an attempt to bring about more co-production and more co-governance with people who use the NHS services. So NHS England are guided more by what the public wants. So I think it's a really nice example of some of the things that the framework is trying to bring about. And I want to show you a little clip of NHS Citizen and some of the events that's been going on, but I'm not able to, we're not connected apparently to the internet in this room, so not able to do that. But if you're interested, do check out the website on NHS Citizen. There's lots and lots of really interesting events happening, and I think that there are signs of how citizenship is beginning to come into the sort of healthcare discourse. I spend quite a lot of my time reading the literature published in citizenship studies and also disability in society, and kind of keeping abreast with some of the thinking around the idea of rights and the idea of citizenship. And certainly within some of that literature, they do highlight us to perhaps not over-focus on individuals and perhaps suggest that a focus on human rights can, separate and atomize individuals rather than thinking about sort of collective autonomy. So while it's helpful to think about self-determination and personalisation, obviously individual funding is really key. It can separate into individuals, so for us to think about not to over-focus on that way and think about relationships as well. And also not to simply focus on relationships with the state. I think it's sort of the relationships we have with each other are key, and we've already heard about that in this room this morning. And this is an image that I took during a residency it was in the English Lake District with some follow-on funding from the ESRC. This is where we planned and worked together on the art materials. And I think there was a lot of hugging that went on during this residency, and that certainly came across, that the sort of meaning of citizenship and the meaning of being together was about that sort of connection with other people, and connection with other people with dementia in this case, and that came across as very, very critical. And quite a key idea maybe is to think about civil sociality. And basically that means that the relationships we have with each other in order to affect societal change. And Trevor Stake, the author here, talks about perhaps thinking beyond the state and think about what people are doing within their neighbourhoods, within their communities, in a way that's bringing about societal change. And recognising that perhaps citizenship doesn't necessarily hinge upon the state providing us with something or bestowing something upon us. And there's kind of room for manoeuvre. So I think that notion of civil sociality and thinking about what's happening within society is quite a helpful one. And also going back to one of the earlier points that Tim made, and the importance of making connections, and I think that's highlighted very well there. And at this point I was going to ask us all to sort of kind of connect with each other. And if you felt so inclined to give the person next to you a hug or a smile at least, or touch their hand, just so we make a bit of connection with each other.
It's fascinating similarity of the experience.
So the phrase we came up with at the end of this residency was Hug Central, because we were hugging each other quite a lot throughout the few days we were there. So thank you for doing that. Hope you enjoyed that connection. So I just wanted to finish with just a very short clip from a film. This is a documentary film that was commissioned by myself and Caroline Hick, who's a visual artist, and we made it back in 2012. You can watch it in full on Vimeo. I don't know if anybody has watched Agnes and Nancy.
Where do you know? We could see the very tip of this kind of, I don't know how to explain it, the tip of the way when the water and the land meet.
Right.
And that point comes right out, and the tide will come right up, and then it'll stop, and then it goes back out again.
Oh, right. And
then it comes in again.
Like
and then it goes, so it just is, it comes all backwards and forwards. I think there's a half-hour's difference between each tide, roughly. And I'm just thinking that's exactly where it was. So it must have been, this is morning time, isn't it? Yeah, this is morning. Listen to me, this is morning time.
Lunchtime.
Oh, it's lunchtime, right.
25 minutes to 1, so it's lunch-ish time. So it was.
Well, I mean, it's not,
evening,
that's right. It was like,
evening.
Yeah. Well, there's something like 2 hours missing somewhere, I think.
What's new, Nancy? What's new? I miss time. Do you miss time? I miss time all the time.
Okay, I hope you enjoyed that, and thank you very much for listening, and enjoy your lunch.